Hi, my name is Joan Romboli, and I am the owner and operator of Landmark Family Healthcare in Londonderry, New Hampshire. I currently have 2 VAs from Cool VA. I am extremely satisfied. The quality of work is unmatched by anybody else. I have been approached by other VA services that might be a little bit cheaper and in trying to entice me. However, I have been extremely happy with the quality of the work of my VAs. Both of my VAs come to work every day. They show up with a smile. They're always professional, attentive, and are open to any discussion on how to make things easier and better. And they always want to follow guideline. They work closely with all of the staff members, and my staff members have really developed a great rapport and relationship with both of my VAs. I have had to reach out to administration a couple of times, and I can tell you that I have had no problems at all getting my message across, or if anything has to be done in the way of corrections, it's dealt with promptly. Our practice has 7 providers, and we've been in business now for 24 years. We'll be celebrating 25 years next year. And we are a family practice, so we see everybody from cradle until elderly. The reason that I reached out to hiring a VA, which was not an easy decision because it's a new model, right? So it's a little bit more difficult to wrap your head around having this type of service. But the reason being is that the administrative tasks are just ridiculous, especially in family practice. We tend to get a lot of the overload from specialists and other disciplines. So we really needed help, especially with things like referrals, chart prep, and all of those types of things. Lots of administrative duties behind the scenes that I just can't have my staff have enough staff to be able to get this all done. Solutions that I've tried in the past is hiring more staff. That didn't always seem to pan out because first priority is patients in-house. So all of the things that are left to do behind the scenes is left till the end of the day. A lot of things weren't getting done, and there's just too many interruptions, distractions. So having a VA 40 hours a week, or a couple of VAs 40 hours a week behind the scenes, working 40 hours plus, and getting things done without those distractions and interruptions has certainly proved to be more beneficial. Since starting with Cool VA, we've had much more efficiency in the things that I always wanted to get done, like the chart prep. A lot of times that wouldn't happen, or that would be left up to me to try to get things done and prepared for all of the providers. So it's just much more efficient. And again, the things that I really wanted to have done behind the scenes is actually getting done. As far as the referral process, my office manager would take her computer home at nighttime. She would be working through the night, many nights, trying to get all of these tasks done that just couldn't get done by the regular staff during the day. This was unfair, so I feel like all of my team members or people in the office have a better work-life balance. And I try to achieve that also with my VAs because they deserve it just as much as everyone else. I can tell you that everybody's quality of life has changed. As far as, like I just said, the work-life balance. My staff comes into work every day. They show up. They don't call in sick. They're very responsible because they know that I've gone out of my way to try to make their jobs more efficient and easier to try to complete in a reasonably comfortably, I think it's a very comfortable environment for them to come in. They don't feel like they're pressured all day at work and then go home and be so tired. But I can also tell you that my staff members, the providers who see patients, are extremely happy with the service because they can get things done more efficiently. They can see more patients in a day because of it. So we certainly have seen an increased number in the amount of patients that we can see in a day. And that's all due to the services of having a VA or a couple of VAs. As an owner of a business, I'm always aware that when people do that, they really should be paid for it, and that's overtime pay. So it's changed all of that. I couldn't be more clear. Work-life balance and decreased stress has been the biggest help for all of us, and there are 17 employees. I actually have had a couple of other offices talk to me about what they're doing about staffing. Sometimes it's hard to find some quality employees. And again, the cost of employment is through the roof. So I've actually referred them to Cool VA. I believe one practice that I did refer has 4 VAs, and actually a dental office. I was talking to my dentist about it. I know that she has one and looking to get another VA from Cool VA. Extremely satisfied, both of these offices. But I certainly would encourage people to investigate